Good morning, ladies and gentlemen. I am Colonel Dr. Anup Krishnan, and it is my privilege to welcome you to this course on physical medicine and rehabilitation in sports. This is week 1, lecture 1, and today we will be dealing with Introduction to Physical Medicine and Rehabilitation. It can be abbreviated as PM and R or PMR. I'll be covering this lecture as per the following outline. We will try and define the specialty. We will go through the introduction and scope of the specialty. We will look at the various training and subspecialties which are available in this subject. We will look at the role of the physiatrist in rehabilitation. We will look at the indications for rehabilitation. We will look at the approach to rehabilitation and the approach to a patient. We will look at the goals of rehabilitation. We will discuss the laws which are there in this country and abroad for care of the disabled, and we will conclude with a take-home message. To define PMR, it is the branch of medicine that targets to improve and restore biomechanical movements, functional ability, and the quality of the human body. And this branch is referred to as physical medicine and rehabilitation. It also deals with the injuries related to the central nervous system and the musculoskeletal system. Physiatrists are defined as nerve, muscle, and bone experts who treat injuries or illnesses that affect how you move, who diagnose and treat pain, who restore maximum function lost through injury, illness, or disabling conditions, treat the whole person, not just the problem area, and who lead a team of medical professionals providing non-surgical treatments and give detailed explanations about your medical conditions and treatments and the prevention plan. PMR or physiatry is a medical specialty focused on prevention, diagnosis, rehabilitation, and therapy for patients who experience functional limitations resulting from injury, disease, or malformation. It has its beginnings in the early 20th century, but the fundamentals of the field originated much earlier during ancient times. The history of PMR crosses across many cultures and geographic boundaries. Scope of the specialty. PMR encompasses a variety of clinical settings and patient populations. In the hospital settings, physiatrists commonly treat patients with amputation, spinal cord injury, stroke, traumatic brain injury, and other debilitating conditions or injuries. In the OPD settings, physiatrists treat patients with muscle and joint injuries, pain syndromes, non-healing wounds, other disabling conditions. Physiatrists are also trained to perform injections into joints and soft tissues as a pain treatment option and for relieving the inflammation inside the joints. Physiatrists are also trained to conduct nerve conduction studies and electromyography to diagnose and treat a variety of central nervous systems and musculoskeletal system conditions. The physiatrist usually leads a multidisciplinary team that includes the physiatrist, nurses, physiotherapists, social workers, occupational therapists, vocational counselors, prosthetists, orthotists, and speech therapists. There may be other specialists who may be pulled in as per the requirement of individual patients. So how do you train in physical medicine and rehabilitation? In the United States, There is a residency program for physical medicine and rehabilitation, which is of 4 years long, 1 year of internship and 3 years of residency. In India, we have an MD program of 3 years after MBBS. Residents are trained in the inpatient setting to take care of multiple types of rehabilitation, including spinal cord injury, traumatic brain injury, stroke, orthopedic injuries, cancer, cerebral palsy, burns, pediatric rehab, and other disabling injuries. The residents are also trained in the outpatient setting to take care of the chronic conditions which the patients may develop following their inpatient stay in hospital. Residents are also trained to perform diagnostic and therapeutic measures, including electromyography, nerve conduction studies, musculoskeletal injections, and trigger point injections. There are several subspecialties which come under physical medicine and rehabilitation: neuromuscular medicine, pain medicine, pediatric rehabilitation medicine, spinal cord injury, sports medicine, brain injury, hospice and palliative medicine. There are several fellowships which are available throughout the world for further training for specialists in PMR. Musculoskeletal or spine, stroke, fellowships in multiple sclerosis, fellowships in management of neurorehabilitation, fellowship in electrodiagnostic medicine, fellowships in cancer rehabilitation, and fellowship in occupational and environmental medicine. So, what is the role of rehabilitation? Rehabilitation is the utilization of the existing capacities of the handicapped person by the combined and coordinated use of medical, social, educational, and vocational measures to the optimal level of his or her functional ability. It makes the patient's life more meaningful, more productive, and therefore worth living. Rehabilitation must be started at the earliest possible time in order to ensure the best results. Rehabilitation is always administered in conjunction with specific medical or surgical treatment of the precipitating disease. Rehabilitation may be medical or socio-vocational. Medical rehabilitation is the utilization of medical and paramedical skills to help treat the patient. And the role of medical rehabilitation is to limit disability. Socio-vocational rehabilitation usually follows or may be delivered simultaneously along with medical rehabilitation. And the role of socio-vocational rehabilitation is to limit handicap. The role of rehabilitation is to minimize disability and handicap and help a handicapped person lead a useful life within his limitations. In other words, rehabilitation aims to make a disabled person into a differently abled person. If you plot dependency versus time, and if you look at a normal individual is self-dependent, but over the period of time, his health may decrease and he may go from self-dependent to partially dependent to totally dependent as age increases. Now, if a person has a disability, he will fall somewhere between partially dependent to totally dependent. If he does not get any rehabilitation, or if rehabilitation is denied to this person, he will continue to be in the partially dependent to totally dependent spectrum. However, if timely rehabilitation is provided, this individual can be brought up to almost the self-dependent state. And this is the importance of physiatry and rehabilitation services. If rehabilitation is provided and continued to be provided, the individual may continue to be almost self-dependent for a long period of time. So what are the indications for physiatry or physical medicine and rehab treatment? There are many injuries or medical conditions which can affect the ability to function, such as brain disorders such as stroke, multiple sclerosis, or cerebral palsy, long-term chronic pain including back and neck pain, major bone or joint surgery, severe burns, or limb amputation. Severe arthritis, which may become worse over time. People who are recovering from severe illnesses such as infection, heart failure, or respiratory failure may require physical medicine and rehabilitation treatment. People who have spinal cord injury or brain injury will definitely require PMR treatment. There are some pediatric indications for PMR treatment. Children may need rehabilitation services for conditions such as cerebral palsy and other musculoskeletal diseases. Children with Down syndrome or genetic disorders may require rehab. Children with intellectual disability, children with muscular dystrophy or other neuromuscular disorders. Children with sensory deprivation disorder, autism spectrum disorder, or developmental disorder do well if provided with timely PMR treatment. Children with speech disorders and language problems recover much faster and may function almost normally if provided with timely PMR rehab treatment. Approach. Many specialties focus on the acute management and the stabilization of pathological conditions like treatment of pneumonia or stabilization of a fractured femur. PMR focuses on a holistic, patient-centric care that addresses the acute and chronic management of the pathologies by medical, surgical, social, and vocational means. The physiatry treatment often includes medications, therapeutic exercise, injections, surgeries, physical modalities, and education. Plan of treatment. PMR helps to maintain and restore optimal function for patients by emphasizing upon prevention, diagnosis, and treatment of functional limitations. It is known as the quality of life medical specialty. PMR aims to enhance a person's functional prognosis through a dynamic, team-oriented approach. There are different phases of medical treatment. Preventive medicine is the first phase where a disease is prevented from occurring by avoiding the interaction between agent, host, and environment. Curative medicine is the second phase, which focuses on attempting to treat and cure the disease. And rehabilitation medicine is the third phase of medical care, which deals with improvement of function through reducing impairment and preventing or treating complications of persons with disability. What are the goals of rehabilitation? Handicapped individuals often have problems with orientation. This will hamper his activities of daily living like feeding or using the toilet, etc. Handicapped individuals have problems with physical independence, and every handicapped individual has dependence upon people who are taking care of him. Mobility. Poliomyelitis and paraplegia are conditions that severely hamper mobility and affect even day-to-day tasks like moving around the house. Occupational integration. There is no point in making an individual self-sufficient if he cannot earn a living for himself or herself. So, occupational integration, including training and placement in a suitable job, is one of the goals of rehabilitation. Social integration. A person cannot survive as an island, and attempts have to be made to integrate handicapped people into the society and not to keep them isolated. Economic self-sufficiency. He or she must be placed in a job which can ensure a means of livelihood and a means to live a dignified life. Impairment. It is defined as any loss or abnormality of psychological, physiological, anatomical structure or function. Example, loss of a finger, loss of conduction of impulses in the heart due to a heart block or cardiac arrhythmia, or loss of certain chemicals in the brain leading to Parkinsonism. Disability. Any restriction or lack of ability to perform an activity in the manner or within the range which is considered normal for a human being resulting from impairment. Example, difficulty in walking after lower limb amputation. Handicap. A disadvantage for an individual in his or her social context resulting from impairment or a disability that limits or prevents the fulfillment of a role that is normal for him or her. Handicaps. The WHO has identified 6 handicaps: locomotor handicap, visual handicap, hearing and speech handicap, cardiopulmonary handicap, intellectual handicap, and emotional handicap. To put it more clearly, impairment is the manifestation of a problem at the tissue level or the organ level. Disability is at the level of an individual, and handicap is the translation of the problem at the society level. There are certain laws which govern people with disabilities, and the passing of the Americans with Disabilities Act in 1991 was a landmark in the life of the disabled in the US. In India, the equivalent act is the People with Disability Act, which was passed in 1995. In addition to these laws, which are nation-centric, there are several international laws. The WHO Global Disability Action Plan 2014 to 2021, the World Report on Disability, and the Convention on the Rights of Persons with Disability focuses the international health community towards the requirements of the person with disability. What is our take-home message? Physical medicine and rehab is a medical specialty which deals with the care of the differently abled. PMR is a team effort which aims at providing the disabled a vocation, a barrier-free place to live, and the right social environment to reduce his handicap. There is a concept of the right to work, that is, to treat work as much more than a means to make money. PMR aims to make the disabled an independent contributor to society so that the person can stand on his own legs. And please ensure that you show a disabled person empathy and not sympathy. These are our references, ladies and gentlemen, and I strongly urge you to go through them in the interest of more detailed learning. I seem to have finished, ladies and gentlemen. Thank you very much for listening. Thank you and Jai Hind.